Testing positive for HIV in 2021 is very different than it was when the HIV epidemic began in the 1980s. For a long time, an HIV diagnosis was considered a death sentence. But now, with powerful medications, people with HIV can live long and healthy lives. In this video, we'll talk about what to expect when starting treatment for HIV. First, what is HIV? HIV stands for the human immunodeficiency virus. HIV weakens the immune system's ability to fight infection. HIV attaches itself to a type of human cell known as the helper T cells. HIV uses helper T cells to create more and more copies of itself that are eventually released into the blood when the T cells are destroyed. So what are helper T cells? Imagine you're calling 911 for help in a crisis. Helper T cells are the 911 operators that pick up your call, assess the situation, and send out the resources you need. Helper T cells signal to other types of immune cells to do their job, so when helper T cells raise the alarm, these other cells spring into action to recognize and kill infected cells or germs that have entered our body. What is antiretroviral therapy? Antiretroviral therapy are medications that stop HIV from making copies of itself and destroying helper T cells. When antiretroviral therapy is working, the immune system has time to recover and replenish its stock of helper T cells. As of right now, there are more than 30 HIV medicines available. Most of the time, people recently diagnosed with HIV, however, can take just one pill a day. Your healthcare provider will work with you to choose the best possible medication for you. People diagnosed with HIV should start antiretroviral therapy as soon as possible. This will help to prevent the progression of HIV and also reduce the spread of HIV to others. So how will you know if the medication is working? Your healthcare provider will be following two tests closely: the HIV viral load and the CD4 count, or the T cell count. These tests will help you understand how well HIV is being controlled by the medication. HIV viral load measures the amount of HIV in the blood, and the goal of treatment is to make the viral load as low as possible. This is also called viral suppression. With HIV medication, it's possible to get the viral load to be so low it cannot be detected by the lab test. This is called an undetectable viral load. HIV has no cure right now, so having an undetectable viral load does not mean that the virus is no longer in your body, but it does mean that the amount of virus is so low that it can't do much harm. An undetectable viral load means that the medication is working and your T cells are protected. Once treatment begins, it can take about 3 to 6 months for the viral load to be undetectable. Having an undetectable viral load also means there's very low risk of passing HIV to a sexual partner. A public health campaign known as U=U launched after major medical studies showed that undetectable viral load equals untransmissible. These studies followed thousands of couples where one person was infected with HIV and the other was not. They found that there were 0 instances of HIV transmission during unprotected sex between partners when the person who was HIV infected had an undetectable viral load. Your healthcare provider will also monitor your CD4 count. This is the medical term for the number of helper T cells in the blood. This is important for monitoring how well your immune system is functioning, and the higher your CD4 count, the better. As the viral load decreases, the CD4 count increases. If HIV goes untreated, the CD4 count will progressively decrease. If the CD4 count drops below 200, HIV has progressed to AIDS, or acquired immunodeficiency syndrome. AIDS indicates that your immune system is very weak, and you're at high risk of serious infections due to other viruses, bacteria, or fungi. So can the medication just stop working? When HIV is making copies of itself in the body, it can sometimes make mistakes. This is called mutating. Mutations can develop that mess with the ability of antiretroviral medications to do their job. This is generally called drug resistance. Although mutations can develop while a person is on medication, The risk is very low if you take your medication every day and your viral load remains low. Starting and stopping HIV medication, however, is bad and can lead to drug resistance. Patients have asked me, do I need to take this medication for the rest of my life? Because there's no cure for HIV today, once you have HIV, it is with you forever. So yes, people with HIV need to continue antiretroviral therapy for the rest of their lives until we have a cure. However, the options for antiretroviral therapy have come a long way, and treatment today is as simple as one pill just once a day and has minimal side effects, just like the management of other chronic health conditions. We have covered a lot of information in this video. Let's recap. HIV is a virus that weakens the body's ability to fight infection. Antiretroviral therapy are medications that stop HIV from destroying helper T cells. The viral load refers to the amount of HIV in the blood, and an undetectable viral load means that the virus can't be detected with lab tests. This is the goal of antiretroviral therapy. HIV has no cure, so having an undetectable viral load does not mean that the virus is no longer in your body. It does mean that the medication is working and your T cells are protected. Having an undetectable viral load also means there is very low risk of passing HIV to a sexual partner. The last few decades have seen an explosion of HIV research. Social stigma has surrounded HIV since the beginning of the epidemic, but as time goes on and medical knowledge improves, HIV is now recognized as a manageable chronic condition like diabetes or heart disease. Reach out to your healthcare provider if you have further questions or concerns, or visit the CDC's website on HIV for more information.